So, how does Caring Dad support prevention work? We've already introduced ourselves, and we forgot to introduce Tracy. Tracy Cockrum is our FFPSA Prevention Consultants Director for across the state. I was just kind of curious, and my colleague Jill is going to help out with the chat. If anybody that's in the audience is familiar with the Caring Dads, or if you've made a referral, if you want to put that in the chat, that would be great. We'd love to hear and see if anybody's got any experience with it. All right. So the program goals, we kind of touched on that earlier, but this program fits within the Families First Prevention Services Act, FFPSA for short, framework because it encourages prevention in child maltreatment and promote family preservation. It focuses on that prevention before removal, and it strengthens family functioning, and it addresses that intergenerational patterns of trauma and harm. It focuses on reducing adverse childhood experiences, better known as ACEs, which improves that child safety and maintaining children safely within their families when it's possible. The Caring Dad program, it's available throughout Tennessee and was created as an evidence-informed intervention designed to engage fathers who have used abusive behaviors within the relationships with their families. Its primary purpose is to improve the safety and well-being of children by helping fathers recognize the impact of their behavior, developing healthy, nonviolent parenting practices, and foster accountability. By focusing on fathers, we want to ensure that they are involved with case plans, supporting safe co-parenting and reunification goals, and building fathers' capacities to contribute positively to child well-being because children need their fathers. So why are dads important? We know that when a father's present in a healthy, nurturing way, it can help prevent emotional neglect, exposure to violence. We know that kids that are exposed to violence will have other issues later on. High-risk behaviors such as substance use, running away, delinquency, mental health challenges, anxiety, depression, identity confusion. So having that father in a healthy, nurturing way can help prevent these. So an example of something a supportive dad would say might be, you are valuable, you are safe, you are loved, or I am so proud of you no matter what. So FFPSA prioritizes services that keep children safely at home and reduce trauma. Supportive fathers contribute to emotional and financial stability, being there for their kids, supporting the emotional piece of it, safe boundaries and healthy structure, and positive modeling for relationships. We know that parenting is a very hard job, and having a positive role model and that at least one supportive person can change the trajectory of a youth. So dads can help prevent generational harm. Many fathers in child welfare, they have their own trauma histories, ACEs exposures, absent dads, violence. They may have experienced a lot of things in their own childhoods. They may not have even had a dad, or maybe their father was in prison. And you only know what you've learned or seen in your own childhood. So we just need to keep in mind that they may struggle themselves with their own issues and unaddressed trauma. So it is hard to parent, and this is a vicious cycle of generational harm. But we can stop the cycle. So focusing on building resilience and, just not stopping those crises. Um, Fathers can help build that by teaching coping skills, um, positive mentoring. Children learn from their parents' words and actions. That modeling, taking a breather from stressful situations, encouraging children to use their words and express their feelings, providing that consistent love and stability, being that supportive dad that your child can turn to, and being consistently involved. It's very important for them. They may have missed quite a bit of time of their children's lives, but it is very important for them to stay involved and be a constant. So we know that resilience prevents that future involvement in systems like child welfare, juvenile justice, and behavioral health crises. And we know that's a big issue with children. A lot of children struggle with that. All right, so thinking about what's the number one reason this program is different from your traditional or your standard parenting programs. So I'm hoping we could have some chat conversations. So how is Caring Dads different from a traditional parenting program? Is it because it's, number one, skill-based? Number two, is it parent-centered? Or number three, accountability? So how does the Caring Dads program differ than the traditional programs? Jill, do we have any answers?
Not yet.
Not yet.
So
okay.
Choices are skill-based.
Everybody needs to, don't be afraid to guess. It's okay.
Number three, accountability.
Perfect. All right. So looks like the majority is saying number three.
Yes.
All right. Well, we must have a lot of smart people in here, or people that are paying attention, because it is accountability. So fathers must take responsibility for their past harmful behaviors. That is a major component of this program. The program confronts attitudes that support control, entitlement, or abuse in parenting. Again, dads may have seen this when they grew up, so this is all that they know. This is not a judgment-free space. It's a structured space for self-reflection and accountability. Again, it's modeled in group and individual sessions, and so they're with their peers and able to bounce things off of each other. It is trauma responsive and child-centered. And this program helps men understand how trauma, including their own childhood experiences, how that affects their parenting. It frames behavior changes through the lens of child safety and healing, always prioritizing the child's experience. So it's kind of asking those dads to see how the children see things through that lens. It helps them to identify that and not just work on themselves, but for their child. They're making that behavioral change to help their children. So unlike general parenting classes, Caring Dads is often a part of a coordinated response with Department of Children's Services, safe baby courts, and or domestic violence programs. So the facilitators work closely with case managers, probation officers, or courts to track progress and, most importantly, safety. These are the places that referrals come from. You got DCS, Safe Baby Court, Domestic Violence Program, and there also is an option for self-referral. I know I've kind of given you all a lot of information, and this might be a perfect opportunity to ask if there's any questions at this point.
We did have a couple of people, while we're seeing if there's any questions, Edna, we did have a couple in the chat who mentioned in Midwest and West that they have made some referrals or had a couple of referrals made for caring dads. So,
I love
that's
that.
good to hear. Yeah.
Absolutely.
We have to fight for stuff over on this side of the state. So
we do. Things often
throw
trickle
those referrals in there
very slowly to the West, and we know that. And everybody in the West knows that typically everything starts in the East, and we slowly get it trickled over here. But once we get it, we run with it. So shout out to all my West and my Midwest people that are on here today.
Someone would like to know if there's a cost for dads for this program. Shauna would like to know if there's a cost for dads.
There is not. Now, I think if they made the self-referral, that would probably be a different situation if the department wasn't involved. But through a case service request, it is paid through that. The department is able to pay through it with that.
There does have to be, Shauna, there does have to be an open case while the service is being provided, though, with DCS. So if you're in CPS, then it may be a situation where it has to transfer into an FSS case while the father is completing the program.
Okay. And so now we're going to talk about caring dads as it strengthens protective factors. So parental resilience. Fathers learn to recognize and manage their own emotions, stress, and trauma. They practice accountability and growth instead of denial, blame, or violence. An example of this is a father who used to lash out in anger, now uses learned coping strategies and seeks support. And we have nurturing and attachment. Caring dads emphasizes understanding the child's emotional needs and repairing trust. Fathers are guided in reconnecting with their children in safe, empathetic ways. An example of this is a father begins to read to his child at bedtime and listens without interrupting. Then we have knowledge of parenting and child development. Fathers are taught what age-appropriate behavior looks like and how to parent without control, fear, or intimidation. An example is a dad learns that a toddler's tantrum isn't defiance, but it's a need for emotional support. In social emotional competence of a child, by improving their own behavior, fathers help their children feel safe, express emotions, and build healthy boundaries. For instance, a child once fearful of their father now feels safe enough to ask questions and express needs. In caring dads, it guides fathers in rebuilding trust with their children and co-parents. It teaches healthy emotional expression, empathy, and nonviolent communication, essential for safe co-parenting. In many parenting classes, they're designed for any parent, but caring dads is specifically for fathers who have intimidation, neglect, control, or violent tendencies, who may have minimal engagement in their child's life, and who need both behavior change and parenting skills. So this chart, it compares caring dads and your traditional parenting program. Caring dads, it stands apart because it doesn't just teach parenting skills, it addresses the root causes of the harmful behaviors within the context of fatherhood. In most programs, they focus on child development, discipline strategies, or family routines, but this program goes even farther. So two important parts is the approach and child center. So caring dads, the approach is trauma responsive, cognitive, behavioral, and reflective. And your traditional parenting, it's more educational and skill-based. And then caring dads, it is child-centered, and it's focused on child safety and healing, which are the core outcomes. And traditional parenting is the focus is more on the parent than the child. Caring Dads, it's great because it addresses some fast concerns, which is exposure to domestic violence, harsh or inconsistent parenting, poor emotional regulation, and unsafe co-parenting environments. And for your DCS frontline professional, just make sure that you're always in communication with the facilitator. You reassess your FAST every 3 months, and then you make sure you get feedback from the co-parent and child therapist. So we have a couple of success stories that were given to us from a provider. And they said that the first one consisted of a dad who had been violent in the home, throwing chairs, screaming at mom and his 4 sons. The provider had close contact with the wife and mother, and during the group, he began to realize what he had done because of some of his own childhood trauma from his alcoholic father. He worked through a lot of it in the group and then started individual trauma therapy. He was able to sit down with his family and apologize to them, and then proceeded to take a second job to repair the house. And to this day, his wife continues to message that provider and saying how well he is doing. So it's good to hear. And another example of a success story, another dad was also able to work through some of his problems from his childhood and repair his very broken relationship with his girlfriend and daughter. He loved the group approach so much that when it ended, he asked if he could keep coming back every so often, and he did join another few times. He remarked that every time he went, he got something new, and he called recently and told that provider that him and the mother of his daughter are in the process of getting married. Okay, this is a screenshot from DCS's Caring Dads. On here, we covered a lot of the information on here, but it's under the domestic violence resources. And then there's links, there's caringdads.org is the actual website of the program. And then, so if you need any further information, you can go to your DCS links. And then here's your Caring Dads provider by regions. This is who you contact. You do your case service request for the referral, but this would be your contact information. We wanted to make sure that you had that today. This is your DCS domestic violence liaison map. So we obviously, if you have Caring Dads involved, then you have a domestic violence component. So we just wanted to remind you to make sure that you've reached out and engaged your liaison so they know about the case. Here is your prevention specialists county with your regional consultants. Wanted to make sure that you had this information as well. You can reach out to us at any time for anything, resources, services, case consults. If you don't know who to turn to, reach out to us and we'll help you find out. We're here to support you.
Yeah, I think that's a good plug for us, Jill, because we are here to support DCS, because we know if the frontline professionals are supportive, then that's going to help in turn help support the families that you all are working with. So if you have questions about anything, reach out. If we don't know about a service, evidence-based program, or a resource, we will find out for you. So don't hesitate to reach out to us.
Very true. I did want to just emphasize too, like the importance. I know we talked about the difference between caring dads and a regular parenting program, but overall, when you're working in the space of prevention and what we are trying to accomplish in the work we're doing is understanding the importance of connecting families to the most appropriate services that are offered out there. So when we're dealing in that space of domestic violence or intimate partner violence, like those needs aren't always, as we talked about, effectively addressed just through a typical parenting program that might be designed just to teach basic parenting skills to infants or to young children, and it's not specific to those relationships that are happening in a conflictual home where you've got family conflict and family violence occurring. So it is very important to really think about the types of services that we're connecting to families and making sure that we get them to the most appropriate so that they can develop the skills to sustain. That's going to decrease referrals. That's going to decrease repeat maltreatment because we're building on the protective factors of the family and we're helping them develop some resiliency. So that piece is very important. And then even in contacting, if you're not, I know they offer domestic violence. They talk a little bit about the caring dads in the domestic violence training or the liaison training. But if you're not connecting with your DV liaisons in your regions, I would really encourage you to engage them. Also, when you're working those cases, they can be a tremendous asset to you as DCS frontline professionals working with families. They can walk through that case with you side by side, also as a partner with their expertise around the domestic violence components and really help develop solid plans and set solid directions for the children and the families. So we work a lot, our prevention consultants work a lot with the DV liaisons. They know the DV resources and things that are out there in the communities to support families who are going through domestic violence, but they often can also reach out to us if there's other needs or services that are needed throughout the home or within the home, rather, for us to partner to bring that in. So either way it works, all of us are there to support DCS and that frontline professional that's out there doing that work to help make it as easy as we can to access those resources. So across all of the venues, please don't hesitate to reach out and get that assistance for your families.
Thank you, Tracy. We had a good question in the chat box, but I see Edna did answer it for Jennifer. Does anyone have any other questions for these presenters? We still have quite a bit of time, and I'm sure that they could be a wealth of resources for you all.
And I do want to go back to Jennifer's question for just a minute. If you remember on the on an earlier slide with what Catherine had shared, this program does not replace a batterer's intervention program. So that the batterer's intervention is really designed more for domestic violence situations. So the batterer would go through that program. That's preferred really over just an anger management because batterer's intervention kind of comes from a different angle in terms of the service. So part of that would be looking to see, I know some of the programs, I know at least for West, the program that offers Caring Dads also does batterer's intervention. program for domestic violence, for the aggressors in the domestic violence situation. So I would look into that first over anger management, but it does not replace it. They still may get some of the same things through Caring Dads in terms of learning the reasons behind, if that makes sense, but it wouldn't necessarily be a replacement for that.
And I see Crystal dropped some upcoming trainings in the chat box for you all. Thank you, Crystal. Any other questions? And Edna states that sometimes a batter's intervention program may be court ordered, so Caring Dads would not work for this.
Yeah, that's true. Sometimes they will want them, they may have to go through Caring Dads after they complete a batter's intervention, depending on the severity of the domestic violence.
That's definitely helpful to know. Don't see any other questions at this time. I will go ahead and drop and display the QR code, but please feel free to continue to ask our presenters questions if you all have any.
Thank you all for joining today. We're hoping to, get the word out about Caring Dads and increase those referrals because we do feel that it is a very important prevention tool to keeping children out of custody and keeping them safe in their homes. Kids need their fathers, so we thank y'all for joining today.